Good evening, Philippines. It's Wednesday, October 23, 2013. Welcome to General Assignment Now on its second season. With us tonight is Dr. Josephine Tolentino, Head of Campaign of Janssen Pharmaceutical Incorporated. We always get a lot of audience interest when we tackle health concerns. So tonight, we'll be talking about a very important, if not troubling or frightening health concern. That's prostate cancer. So this is special. Our program this evening is especially important for you guys. No. Anyway, I'm your host, Miguel Gil. All right. Good evening, Dr. Jeff. Can I call you Jeff?
Yeah. Good evening.
Okay. You are
Good evening,
you're the head of campaign of Janssen Pharmaceutical Incorporated.
Yeah, that's right.
So what does the head of campaign do?
So, which means I am the one leading the prostate cancer awareness campaign, and this campaign is really a thrust of Janssen Pharmaceutica to educate and alleviate the burden of the disease, particularly prostate cancer, in the society.
You have an event today?
Yeah, this lunchtime. It's a media launch for this awareness campaign.
Okay, so we are talking about well, prostate cancer in general. I understand this is something that is fairly common, especially for those who get to a certain age.
Well, saying common is not really, common because, as we all know, cancer is not as common as having diabetes or hypertension. But in the Philippines, the data is that it's the 9th leading cause of death, for the Filipinos. So it's quite alarming. That's why we would like to inform all these people watching that this kind of cancer can be prevented.
Can be, and I am told that this particular disease is the most, one of the most treatable of the bunch, no?
Oh yeah, because number one, it's indolent and we can really detect it at its early stage.
Mm-hmm. So they have to go through a certain screening.
Yes, we call that PSA screening.
Okay, so I've told you that 20 years ago I've known people who have actually died of cancer, and that 20 years hence, I have to ask this because I guess this is high on the minds of a lot of people. Is the technology to treat this potentially fatal disease moving any further?
Yes, in fact, as far as I know, when it comes to research, this one has so many advancements. In fact, for breast cancer, there are so many new drugs in the market. Just to share with you, when I was a trainee, I stopped for a year, and when I came back, there are so many data that I have to review again because of many clinical researches for this field.
So, but why hasn't medical science, with all the, I would imagine, billions of pesos and dollars and other currencies pouring into research, because this is killing a lot of people, why haven't we stumbled upon that magic bullet?
Magic drug? Yeah, it's because the cancer has many dynamics. No? It can also mutate, so it's very very difficult really to treat. But I think we have so many scientists that are looking at it right now.
Do you think that if we live long enough, I mean, is there a chance that within the lifetimes of people who are more or less our generation will eventually find a cure for this disease?
Well, probably, yeah.
Hopefully.
Hopefully.
Okay. So, tell us something about this campaign that you launched today, which is zeroed in on prostate cancer.
Yeah, so actually this campaign, we are targeting the men who have age 40 years old and above. And we all know that men do not like going to doctors.
I don't think anyone does.
Yeah, yeah. And I know that you do not go to you do not approach any doctor by yourself, so you need somebody to accompany you. And this person,
it's usually the wife or the girlfriend.
The wife, the girlfriend, the children, any person that is very dear to that to the man. So the people that we are targeting actually here are the women. So Janssen is talking to the wife, to the children, to bring their husbands and their fathers to regular checkup and screening for prostate cancer.
Basically, that's how you survive. And if you catch it early enough, there's a good chance that you can actually survive.
Yes, not only for prostate cancer, but for any other cancers as well.
So, the name of your campaign is
Fight for Your Man.
Fight for Your Man.
Yeah.
So, sa punto de vista nung girl, nung
Yeah.
wife or nung girlfriend, or siguro even the children.
The daughter.
The daughters, yes.
Sister.
Yep.
Yep.
So, exactly what are you promoting here? Are you promoting regular PSA checkups, or how is that?
Yeah.
How does this work?
Basically, it's really the regular PSA testing yearly. So, men start the risk at age 40 and above. So we encourage them to have a regular screening every year.
So prostate is the most common pa rin?
Most common in terms for men,
men,
yeah.
yeah.
Well, different countries, different statistics, but now in the U.S., which we can use as a benchmark, because they have, as we all know, they have this people who really look at statistics. So as of now, it's the number one cancer in the U.S. for men.
Is that a lifestyle thing? Is that more a function of lifestyle? Is that diet? Is that being sedentary? Or what? I mean, or is that sort of a shot in the dark? I mean, a person who can live a totally unhealthy life can be spared of it, while a person who is very, let's say, careful about what he eats, who gets exercise, etc.
Yeah, we always associate diet with cancer, but there is really no hard evidence proof that any form of diet can affect prostate cancer. But what we advise is just like what cardiologists give. We advise a balanced diet, no? That is the key factor.
So can we say that it's preventable if you live in a certain way, or?
Well, just to share, in 2004 there was this clinical research group who showed that lycopene can prevent prostate cancer, but after a few years another group disproved it. So there's really no.
So it's not true that you can. You can sort of insulate yourself from this disease by eating a lot of tomatoes?
Yeah.
No, all right.
But, lycopene also is not proven to cause harm. So there's really no, if it does not cause harm, then it's just okay to really eat tomatoes.
So what do you suggest for the average health-conscious Filipino? Whether male or female, since you're in that particular field?
Well, a low-fat diet, high in fiber, with balance with a regular exercise.
So, low in fat, meaning to say not too much.
You avoid the steak, I know masarap talaga the steak with the fat around it, but
so
you have to avoid it.
Fat.
Yeah.
All right.
Red meat, you have to avoid red meat.
And how about the exercise part? How important is the exercise part?
Well, aside from it keeping you fit, there are some studies also that say that if this group of patients are in the heavy side, they are prone to have certain types of cancer like breast cancer. But these are just associations. So we better, coming from that, let's just avoid being overweight.
And aside from that, no, of course, there are other factors that I would imagine by now has already been proven, like smoking. Smokers tend to get the worst of it, di ba?
And some people
that-
might think that smoking can only cause lung cancer. It does not. It can actually cause also bladder, laryngeal, head and neck cancers.